Hi, my name is Milt Bedingfield. I'm a certified diabetes educator and exercise physiologist. I work in a major hospital here in Tampa. Teach people about diabetes pretty much every day. What I want to take a moment to talk about right now, the question that comes up frequently is, what exactly is the exercise doing that's lowering my blood sugar? I talk frequently about the importance of exercise and how it will actually lower your blood sugar levels, sometimes 50, 60, 70, 80, 100 points or more, depending on how intense your exercise is and how long you're doing it. I use this little demonstration when I teach class. This is what happens when you exercise. You have cells, and there's doors, figuratively speaking, on every muscle cell, fat cell, and liver cell. And the insulin that's made in your beta cells opens the doors to the cells so the sugar can enter. When you exercise, the doors to the cells open a lot easier, and it takes less insulin to get the sugar out of the blood and into the cells. Let me show you. This is an example I use. Let's say, Jim, you over here, you have an exercise today. Doors to your cells are shut. And it's going to take a lot of insulin to get this door open so the sugar can enter. So while you're sitting here in class, your beta cells are working very hard right now, wearing themselves out, making enough insulin to get this door open. But let's say you would exercise this morning. Let's say you've gone for, say, a 30-minute walk, a bike ride, or swim, or you went to the gym for 30 minutes and exercised. This is what happens. Let's say you exercise at 7 a.m. for 30 minutes. As you exercise, the doors to your cells are going to open. They're going to be open the widest while you're exercising. And they're going to gradually close throughout the day. As soon as you finish exercising, they're wide open. It doesn't take much insulin to get the sugar into the cell. The insulin's actually acting like a herd dog that just herds the cattle into the pen. It doesn't take much insulin, so the door's wide open. By noon, when you've eaten lunch, the doors are closed all the way to here. I still call that wide open. For 5 minutes after 5 hours after you finish your exercise, you're still deriving benefit from the exercise you did at 7 o'clock. By evening time, by dinner, they're closed to here. Well, I still call this wide open. You can still get sugar in here. So 10 hours after you finish doing your exercise, the doors to your cells are still somewhat open. You're still getting benefits from your exercise. As you sleep, they gradually close even further. By the next morning when you wake up, doors are almost closed. What do you reckon it's time to do again? Exercise? The whole cycle starts over again. So when you do exercise, regardless of whether it's morning or evening, you're going to derive benefit from that exercise for at least 24 hours. You do it on a regular basis, like daily, and your beta cells are going to, the workload they're having to do to make insulin is going to be far less, and it's very likely you'll be able to prolong the life of your beta cells before they become exhausted.